Hello and welcome to the first in a monthly series of YouTube videos we will be producing on issues of interest to horse owners. I'm Dr. Amy Eggleston, the owner of Eggleston Equine, an ambulatory veterinary practice located in Woodstock, Connecticut, providing veterinary service to horses in Massachusetts, Connecticut, and Rhode Island. Today I'm going to discuss Lyme disease. Now this presentation is not a comprehensive primer on Lyme disease in horses. I will go over a few points related to diagnosis and treatment of Lyme disease in horses. These are points that are important to understand. They should make all of us, veterinarians and equine caregivers alike, take pause when thinking about this disease in the context of our horses. Lyme disease has been definitively proven to cause only 3 diseases or medical conditions in the horse. 1. Uveitis, a severe and painful inflammation of the uveal tract of the eye. 2. Neuroborreliosis, a disease of the central nervous system. And 3. Pseudolymphoma of the skin. That's it. However, when most think about Lyme disease in horses, they're not thinking of the aforementioned diseases. Rather, equine caregivers may comment about clinical effects like stiffness, lameness, muscle tenderness, hyperesthesia, or increased or altered sensitivity to sensory stimuli, resentment to touch or pressure, swollen joints, and behavioral changes. These symptoms or clinical signs are what most horse owners and most veterinarians think of when they think about Lyme disease. Now what's important to note here is that these symptoms are non-specific. Horses can show these types of clinical signs for many reasons, unrelated to Lyme infection. This is not to say that Lyme disease cannot cause these symptoms, or that Lyme disease is not serious in the horse, only that we should be cautious in diagnosing based strictly on clinical signs alone. So let's discuss testing for Lyme disease. There are 4 tests used for Lyme disease diagnosis. The first is the ELISA test. This test can be submitted using serum, cerebrospinal fluid, or CSF, or joint fluid. What are some of the pros and cons of this test? Pros. It identifies a broad range of antibodies against Borrelia proteins. It's a quantitative result, and increased levels may indicate active infection. The cons. In and of itself, the ELISA is of little diagnostic value. Really, an ELISA should be combined with a Western blot test. The ELISA provides no information about the infection stage or any vaccination status. Additionally, cross-reactivity against other Borrelia, spirochetes, or flagella is a concern with the ELISA test. Second, there is the Western blot test. This can be used, like the ELISA, on serum, CSF, or joint fluid. Some pros and cons of this test. Pros. The Western blot, again, identifies a broad range of antibodies against Borrelia proteins. As opposed to the ELISA, it can provide information about the infection stage and vaccination status. Cons. The Western blot is a non-quantitative result. It is subjectively interpreted by each laboratory. Third, the multiplex assay test. This can be used on serum or CSF only, not joint fluid. The multiplex assay targets the detection of 3 different antigens, OSP-A, OSP-C, and OSP-F. The pros of this test include detection of even a low-level antibody, and it can provide information on the infection stage and vaccination status. In addition, it's also quantitative, and increasing levels may indicate active infection. Some cons of the multiplex assay are that false negatives may occur due to genetic variation in one of the proteins it measures, the OSP-C protein. Fourth, there is on the market a SNAP test, which can be used on serum, plasma, or whole blood. The obvious pro here are the rapid results, stall side. Additionally, there is good agreement between this test and the OSP-F protein, the chronic phase protein of the multiplex assay, and also between the Western blot test. Vaccination most likely doesn't affect the results of this SNAP test. The con of this test is that it is a subjective interpretation and non-quantitative result. In addition, as noted, it appears to show good correlation with the chronic phase protein of the multiplex assay, not the acute phase protein. So perhaps a recent infection could be missed as a negative. The bottom line, none of these tests are perfect. None of these tests can conclusively tell you if the Lyme organism is causing your horse's problem, the clinical signs we discussed. Furthermore, there is a potential for false negatives in all of these tests. That is, the horse actually is infected, but the test comes back negative. You can also get false positive with these tests, where the horse is not infected, but the test says that it is. There is a notable example where a veterinarian took blood from ponies in the California desert, an area of the country with no Lyme disease, and found positive results with the above tests. The testing for Lyme disease in horses has improved in the last 10 years, and what we know about the tests and how we can interpret them has improved as well. Still, the imperfect nature of Lyme disease blood tests should cause us to be cautious. Because Lyme disease blood testing is imperfect, and because the clinical signs of the disease are vague, when suspecting Lyme disease in your horse, it's very important to 1. Start with a thorough clinical examination, and 2. Thereby rule out other diseases or medical conditions as the cause of the clinical signs. This approach is often the reverse of what our inclinations may be. Many times, veterinarians and caregivers will treat for Lyme disease first and see what happens. With this landscape, vague clinical presentation and imperfect blood testing, a treat-first approach is not a prudent way to diagnose Lyme disease. Additionally, because of the way the Lyme organism can respond to antibiotic treatment, and because the antibiotics we do have are imperfect when treating Lyme disease, things I'll talk about in a minute, it's even more important to be certain of a Lyme disease diagnosis before proceeding to treatment. After the clinical examination and after ruling out other diseases and medical conditions, blood testing should be done. If the test is negative and you're still suspicious of Lyme disease, your horse should be retested using a different blood test. If this test is also negative, then your horse is unlikely to have Lyme disease. If your horse is experiencing one of the known diseases that Lyme disease causes, uveitis, neuroborreliosis, or pseudolymphoma, doing more specific testing of the spinal fluid or ocular fluid could be called for. If your original blood testing was positive for Lyme infection and clinical signs are in line with possible infection, and other causes have been ruled out, it is reasonable to proceed with a Lyme diagnosis. But you should proceed cautiously, regularly updating your veterinarian and follow through after treatment to confirm resolution of clinical signs and improved blood testing results. Now let's move to talking about the treatment of Lyme infection in horses. There really are only 3 reasonable ways to treat Lyme infection. 1. Orally using minocycline. Typically, initial treatment is 30 days, occasionally 60 days. In 6 weeks after the end of treatment, it's recommended to retest to see response to treatment. 2. Intramuscularly using the antibiotic Exceed, a ceftiofur, which is a 3rd generation cephalosporin. And 3. Intravenously using oxytetracycline. This is recommended only under the direct supervision of a veterinarian in a hospital via a catheter for up to 21 days. All these antibiotics are imperfect, the theme of this presentation. Notice what is not recommended. Oral tetracycline or oral oxytetracycline. These are not recommended for use in the horse under any circumstance. Oral doxycycline. While commonly used and valid for use in humans and dogs, doxycycline should not be used for treatment of Lyme infection in horses. Doxycycline has been shown to have less than an 8% bioavailability when administered orally in the horse. It is simply not absorbed and processed by the horse, and therefore a poor choice to treat Lyme infection. Other antibiotics like amoxicillin, amikacin, Baytril, or SMZs, to name a few. These are all antibiotics that are either shown to be ineffective against the Borrelia organism or pose significant risk to the horse. This brings me to an important update on Borrelia, the organism that causes Lyme disease. Borrelia does not need blood to survive. When Borrelia becomes, quote, angry or agitated, it can morph into what is called an ovoid form, a biofilm. Once in this form, within the horse, Borrelia is undetectable and untreatable. None of our blood tests will pick it up, and none of our antibiotics will touch it. This biofilm form of the Borrelia organism can be triggered by inconsistent or inappropriately dosed antibiotics. If we are treating our horses with too low a dose, or if we are missing administering doses, or if we are using a poor antibiotic choice like doxycycline, we can cause the Borrelia organism to retreat into this form. I would like to take a minute to focus on this point about doxycycline. Not only is this antibiotic pervasive in equine practice, especially in the northeast area of the United States, not only is it poorly absorbed, read doesn't work, but in the case of Lyme disease, it can actually do harm and cause the Borrelia organism to go into the biofilm limbo state within your horse. This limbo state can last for months, years, or for as long as it takes until a more favorable environment for the Borrelia survival emerges in the horse, at which point Lyme disease could flare seemingly out of nowhere with no new exposure to ticks. What does all this mean for you and your horse living in the Northeast, an area endemic with Lyme disease? Lyme disease in horses, while real and potentially debilitating, is not an infection to be regarded as simple. Diagnosing and treating Lyme disease in the horse presents real challenges. As an equine caregiver, you should understand some of this complexity so that you can be the best health advocate possible for your horse. Stay tuned for further YouTube videos and follow and like Eggleston Equine on our Facebook page and on Instagram. If you have questions regarding Lyme disease in your horse, call our office at 860-942-3365 or email me at dr@egglestonequine.com. Thank you.